and welcome to yet another episode of the Health and Wellness Show. My name is Chebet Birir. Na kama kawaida, this is where we empower you, we inform you, and inspire you to take full control of your health and live your best life. Now today we are talking about a very interesting topic, that is reversing hearing loss. You got that right. Yes, it is possible to reverse hearing loss. And with me on set, I have three amazing people. I'll let them introduce themselves and then we'll continue. Karibuni sana to the show, and we'll start with you, Helen, and then we'll finish with Winket with introductions.
Thank you very much, Chebet, and thank you for having us here. My name is Helen Otunga Nyambaka. I'm a clinical audiologist. Yes.
So what does being an audiologist entail?
Being an audiologist is a specialist in ear and hearing. So anything to do with the ear, balance, ringing, buzzing, ear tests, that is
and
me.
all that, yes. Yeah. Karibu sana to the show,
Thank
Helen.
you very much.
Next we have Daktari.
Thank you very much. My name is Elaine Yuko. I'm a consultant ENT head and neck surgeon at the Kenyatta National Hospital, among other places. Yes, I treat above the neck, going up, minus the brain, the eyes, the teeth.
Ear, nose and throat.
Yeah, that's a colloquial term, but as you've had, head and neck.
Head and neck. All right, welcome to the show, Daktari.
Thank you.
And last but not least is Winket.
Okay, thank you, Chebet, for having us here. I'm Winket Jage, a mother to Goreti, who has loss of hearing.
Okay.
Yeah.
But now she doesn't.
But now
She can hear.
she can hear.
And that's exactly what we are talking about. She was born with hearing loss? Or did this happen after she was born?
I cannot say she was born with hearing loss because at 8 months she had meningitis. So it is most probably that is what
An
affected.
effect of
yeah.
meningitis.
Yeah.
We want to understand how that happens even better. How do you reverse hearing loss? And like my guests introduced themselves, we have an ENT specialist and we have an audiologist, and we have Winket, who is a mother to Goreti who had hearing loss, but now she can hear. And I want to start with you, Winket. How was your experience and how did you learn that Goreti might have lost her hearing?
Okay, at the age of 2, that is when I noticed when you call her, she could not turn back when you call her. But she was coordinating very well with other kids while praying. That's when I decided to take her for speech assessment. Then I was later on advised to take her for hearing screening. Yeah.
You've taken us a bit forward, but before you had mentioned 8 months and meningitis.
Yeah, she had meningitis, 8 months. And from there we were back and forth, in and out of hospital. She had loss of anemia, blood, all those underlying issues. Yeah.
Okay. And what made you suspect that she could not hear?
Okay, at first I thought it was normal delay because she had delay while walking. She walked when she was 2.
2 years old?
2 years old.
Okay.
So I thought it was a normal delay. But then later on I noticed when you call her, she could not turn back. Like say when walking, ama kikimbia na watoto, when you call her, she could not turn back. So that's when I noticed something might be wrong. Yeah.
But before 2 years, did you notice anything amiss? Because I know when a child is, I think, from 6 months old, and we have specialists here to help us understand, they can read signs and hear maybe their name, or when you bang a door, they can react. Did you notice any of those?
No, I didn't notice.
Okay.
She is very active, very hyper. She could play well with other kids, so it was very hard for me to notice that.
Okay.
Yeah.
And that brings us now to, I'm not sure who is at a better position to answer that between Dr. Yuko and Helen, but I believe it's Helen, who is an audiologist. So how do you tell that a child can't hear from birth?
So yes, it's possible to tell that a child cannot hear, and initially we do newborn hearing screening, and this is usually done at the hospital in the maternity. Once a child is born, after 24 hours, then we do a newborn hearing screening. It's a very simple test that entails sending a sound signal into the hearing organ, and a certain sound is supposed to come back. We call it autoacoustic emission, OAE in short. So once we are able to register the OAE with our machine, telling us that there's a pass, then we see that the child can hear. If there's it's not a pass, then there will be a refer. If we have a refer, then we have to do the test again within 1 month. And then after that, we follow up. If it's still a refer, we follow up another 1 month. In 3 months, if it's still not a refer, then within the 3 months, we have to do a complete hearing test called an auditory brainstem response, which is called an ABR in short. From there, once we determine that the child cannot hear, depending on the degree of hearing loss, then we are able to determine if this child needs hearing aids, if they need cochlear implants, or if they need a referral to the ENT. Because sometimes it could be other reasons as to why the child cannot hear, probably some deformities, absence of a certain hearing organ, or malformation, and so from there we are able to determine what to do. But if we have what we call sensory neural hearing loss, that is hearing loss in the inner ear, then we have to always plan for hearing aids and plan for cochlear implant.
Okay.
Yes.
And also like us to hear from Dr. Yuko, who is an ENT specialist. Dr. Yuko, Helen has mentioned some of the causes or the possible causes of hearing loss. Would you please expound further on what would cause a child not to hear? And then we'll go into teenage and adulthood. What causes hearing loss as someone grows?
Okay, so our ears are the only organs that are fully formed by the time we're in your second trimester in the womb. So any insults, that means like any diseases that affect the mother from the time of conception up to that time, can affect the child's hearing once they are born. So the different diseases, and there are many, that's why we vaccinate, rubella, measles, there are several, even just treatment for things like malaria and tuberculosis. So that's why the mother's health, even before she gives birth, is very important. Once you're born, then, and hearing, we have, our ear has 3 parts: the outer ear, middle ear, and the inner ear. The inner ear is the one that uses like the electrical impulses and goes all the way to the brain. The outer is this one that gathers the information like a satellite dish, then the middle. So you can lose hearing from, if it could be a deformity on the outside part of the ear, the middle, and the inside. So the outside part of the ear could be maybe like when you are being formed, it didn't fully form completely, or injuries or things like that. The middle part, and then there's the canal that enters the ear. You could have wax and other things like that blocking the ear, but commonly wax. Then our fluid, as she said, in the middle ear. Then the inside part of the ear is usually a nerve type of hearing loss. That's one we call sensory neural hearing loss. So that one can be caused by congenital problems, can be caused by diseases like meningitis at birth, can be caused by conditions like when you're in the NICU, when the neonatal ICU, babies who are born and have to stay in nursery a while, so maybe they jaundice, their eyes were yellow, or they had reduced oxygen to their brain. All those things can affect your hearing. We're happy to say that right now the neonatal screening is going on in many hospitals, newborn hearing screening. In the private hospitals, it is going on. In the public hospitals, we are just starting. Kenyatta has started newborn hearing screening. But currently we are starting with the at-risk babies, like the ones who have been in the nursery, the pediatric, like the ICU. We are starting with those. So for the, and you asked Mama Goretti something, what if she noticed? So we usually ask the parent, if did you ever notice if your child used to startle? Like when you enter a room where there are babies, usually you find people tiptoeing, closing doors silently, gently. So if you have, if you notice that that is not happening, and usually parents will tell you, I noticed it up until this point. So you look for things like that. Did the child used to follow the mother's voice? Okay, anybody's voice, both parents, but especially the mother's voice when she enters the room before they see them. Then now is when you start asking about talking, because now we talk a little bit later. Some talk earlier, especially girls, but from at least a year onwards, you start developing some speech, 1 words, and you increase your speech. So you ask the parents about that. What level of speech are there? Does your child babble?
Okay.
Because sometimes you find a child who is silent. So when they are interacting with you, they are babbling, they are actually trying. Sometimes you'll find the child maybe had some hearing and they have lost it, and what they're doing now is they're using their eyes as their ears. So the child looks at you and then they now respond to what you're saying by looking at your lips. So that's why it's very important to bring them for the hearing test as soon as possible. Do not go to a medical professional and have them shake keys, or like the way sometimes you hear the teacher said, I shook the keys and the child can hear.
Okay.
Go for a proper test to confirm the exact level of hearing.
We'll come back to that, and I'd like us to go back to Winket. And Winket, you said that at 2 years old, when Goretti was 2, is when you noticed that something was wrong.
Yeah.
And she was a very active child, so it was difficult to tell that she could not hear. So what actually made you go to hospital? And you said you took several tests. How was the process, and how did you feel after you were told that Goretti cannot hear?
Okay, when I noticed when I called her, she could not turn. That is when I decided to take her for speech assessment. I looked for a speech therapist. I took her for speech assessment. Later on, she advised me to take her for hearing screening. I took her to Nairobi Hospital. Yeah, and that's when I was told she has profound loss of hearing. Maybe Helen can tell us what is profound.
What it means to have
profound loss of hearing. But I was advised at that stage I could take her to special school or have cochlear implant.
Okay.
Yeah.
Helen, please explain to us now the ranges of hearing. How do you diagnose hearing loss?
So diagnosis of hearing loss happens excuse me, differently for different age groups. For children, as I had said, we start with the newborn, then we have auditory brainstem response, because these children cannot be able to give you any response verbally or physically that I have heard that noise and so I need to respond, and they cannot be able to understand. So that's why we do that. Usually between the age below 3 or sometimes 4 years, or individuals who cannot be able to neurologically understand that they're supposed to do this. Then we have another test called pure tone audiometry. Pure tone audiometry is where we give instructions or we condition a child to be able to give us a response. And so they're able to hear a particular sound, and this sound, the response will either come through putting an object in a container or putting an object somewhere or pointing an object. That is for children under 5, sometimes 7 years old. But for older children, it's either raising up their hand or pressing a button, also for older adults. Once we are able to establish, we are able to do a hearing test, then we'll be able to establish the degree of hearing loss and then the type of hearing loss. So the degree will be, is it a normal hearing? Fine, that is good. If we have hearing loss, is it mild, moderate, severe, or severe to profound? So mild hearing loss is between 25 decibels. So we test hearing in decibel and frequency. That is, I will say in short, in volume and in pitch. Okay. So once we have been able to establish that it's a mild or it's a moderate severe, then what type of hearing is it? So is it a hearing loss that is coming from the outer, the middle, the inner ear, or a combination of the three, okay? But mostly the two, middle ear and inner ear. So once we have established the type of hearing loss, it helps us to determine what are we going to do with this particular person or with this particular child. So if it's usually a conductive hearing loss that is affecting the outer and the middle ear, then most of the time, I'm saying most of the time because not all the time, it's treatable by medication and by surgery, most of the time. If it's sensorineural hearing loss that is affecting the inner ear and the nerve and sometimes the brain, most of the time it will also use hearing aids. And there are moments where the hearing aids cannot really be effective enough and we have to do cochlear implants. And so most of the time for cochlear implants is where now we have at a severe profound hearing loss, and so the person will not be able to really benefit well from hearing aids. Yes, we give them hearing aids to be able to activate the sound that is going into the nerve, to keep the nerve active, and to just help them be aware of sound. But eventually they will need a cochlear implant to be able to hear sound better.
Mm-hmm.
Yes.
Thank you so much, Helen. And we're going to take a very short break. When we come back, we'll talk to Dr. Yuko, and she'll tell us how do you decide that a candidate is good for cochlear or hearing aid, right? Stay with us, and also stay with us. Don't go away. Welcome back. If you've just tuned in, this is the Health and Wellness Show. My name is Chabet Birir, and today we are talking about hearing loss, the stages of hearing loss, what causes hearing loss, and it is actually possible to reverse hearing loss. And with me on set, I have Dr. Helen, who is an audiologist, Dr. Yuko, who is an ENT specialist, and Winket, who is mother to Goreti, who had hearing loss, but now she can hear thanks to a cochlear implant. Karibuni sana to the show once again, and thank you for joining us. Before we went for the break, we were talking about how to decide that someone will have an implant or a hearing aid. And I'd like Dr. Yuko to explain to us, how do you decide that from a child to an adult that they will now have hearing aids, and how do you also decide that they will do a cochlear implant?
Okay, so to decide who gets the hearing aids first and the implant, first you go to Helen.
Yes.
Then Helen tests you.
Mm-hmm.
So once Helen has tested you with the different ways, either the pure tone audiometry or the ABR, as she's mentioned, and then she gives us now your level of hearing.
Mm-hmm.
So with your level of hearing is how we decide. So if you have mild, before people used to be told that if you have mild, maybe you're just adjust your lifestyle, but now we say there's hearing aids for mild. So if you have mild hearing loss, there's hearing aids. Moderate, even up to some moderately severe, there's some very high powered hearing aids. If I'm lying, Helen would say. Because the hearing aid, you need when you need to be able to convert the sound to the brain impulses, and by the time you get to profound, the hearing aids will not going to be able to do that effectively. They might just create sound, but it will be difficult for the conversion. So that's when now we bypass it and we go straight to, we use the cochlear implant, which we put the electrode right in the cochlea, which is in the inner ear, and that takes the microphone collects the sound and it takes it straight towards the brain, and it's converted there. So usually, even if you have a cochlear implant, it doesn't mean that now I'm wearing specs. Without the specs, I don't see. So the cochlear implant will assist you in hearing, but when you remove it, remember that you still cannot hear.
Okay.
Yeah, so you still have the hearing loss, but now you have an aid to assist you. So, and the types and also why we wear hearing aids even before, why we advise people to wear hearing aids even when you have severe and you are awaiting the cochlear implant. Any part of your body that you don't use sort of goes to sleep, especially your brain. So if the part of your brain that processes hearing, which is above here, it's called the temporal lobe. If you don't use it, it goes to sleep. The proper word is it'll atrophy. So then it'll be very difficult later to process sound. So you need to keep stimulating the place. So like even the way people do physiotherapy, to continuously stimulate. So you wear the
memory.
Yes. Yeah, very clever. So you continuously do that so that it stimulates even as you're waiting to get the facilities, the funds to be able to do your cochlear implant. So even I'm sure Mama Winket at some point you did wear Goreti wore Mama Goreti wore hearing aids, but they were not found to be useful, to be
effective. And now we want to hear from her, Winket. How was the process like? Like, were you explained? You said that you were told it was profound hearing loss, meaning the hearing aids could not work. So, how did it feel for you to be recommended for the cochlear implant, and what was the process like?
Okay. When I went to Nairobi Hospital, they did not explain much about the cost and what it entails, the whole process about cochlear. I learned it for myself through internet. So I went to internet and searched what is cochlear implant. Later on I saw Mpisha, they had an initiative. I can't remember when it was. So I went to Mpisha to inquire about cochlear implant. That is where I was told the cost of the cochlear implant, which is 2.7 million. It was a shock because at first when I was told she's going to have a surgery, I thought it was maybe around 500k or 300k. I never expected something
expensive
like
like that.
Yeah.
Okay, and so how did you react? Did you get the support you needed immediately? And how was the journey basically?
Okay, I was shocked. The whole family was shocked. Yeah, but I met a very good doctor. He is Dr. Shaidra. He works at Mpisha. He advised me first to start with the hearing aids. And we bought the hearing aids at the cost of 100k. Later on, we decided to have a fundraising. We decided to go through with it. We ended up fundraising. It was a very tough journey because people were not understanding what is cochlear implant. So when you tell them there is an implant that can make out talk, it was very difficult. But I thank God, my family and friends back where I come from, they were very supportive. Because in one day we managed to get around 960k. And then Dr. Shaidra consulted from India, where it was a bit cheaper. It was around 1.5 million. So that's when we decided to go to India.
Okay.
Yeah.
So you went to India for I understand you had 2 different implants.
Yeah.
So the first one was done in India.
In India, 2023.
In 2023.
Yeah.
How old was Goreti then?
She was almost 4.
Almost 4.
Yeah.
So the first time she heard was now in 2023.
Yeah.
And
but at first when she started using hearing aids, we could see the response.
Okay.
That's when we got determined to go on with the cochlear implant.
Okay.
Yeah.
And how was it like for you when she could now hear? And because I remember when we did the interview with you, you actually was very emotional, and you're talking about how the society does not understand people or parents who have children with disabilities. So how was it for you when you could notice that now Goreti can hear?
I was very happy because from when she was 2 years, I could not attend in social gatherings because with that kind of a condition, it is very hard to do toileting. And at the age of 3, she was not able to go to toilet by herself. So you find you cannot go to social places because people will not understand why you are using diapers. Why, it is kind of very difficult. So for like 3 years, I've been home. I did not want to go to any social gatherings. People cannot understand why a child is so clingy, you know, all those things.
Yes.
Yeah.
And I'm glad that you overcame all that, and now you are advocating on that topic and why it is possible to actually reverse hearing loss.
Yeah, it is very possible.
Yes, I want to go back to the specialists now. Winket has shed some light on, you've talked about wearing pampers, you know, living with people when your child cannot hear or when you yourself cannot hear. So how would you advise parents or even caregivers and the society at large how to handle someone with hearing loss? We'll start with you, Helen, and then Dr. Yuko.
Okay, hearing loss as to how we understand is very difficult for most people to understand, and especially because people have always known hearing loss to be something for the old people, okay? But as we live by, we have come to know that it doesn't matter the age of the person. And so most of the time, children will be discriminated, parents will be discriminated. People will say, in our traditional African society, people will say it's some witchcraft. There's something the mother did, there's something the grandmother did, or, you know. So there's a lot of discrimination. but it is important for these children or for these parents to really get enough support. And some of the support, like what Mama Goreti has spoken about, is when the society is able to come in and actually help by contributing finances towards ensuring that this child or this person is able to wear the hearing aids or get the cochlear implant. The other way is family members should be able to be understanding that this person is not able to hear them or is not able to hear them properly. So just getting the attention of the person when speaking to them is important. Speaking to them slowly and not shouting, because when you shout and the person has some hearing loss, it just distorts the speech. So just talking to them slowly, not like slurred speech, but just talking to them slowly
in a low tone.
In a low tone, it helps them be able to understand and be able to know, because some of them, as Dr. Yuko has said, now we start adapting to using our eyes to hear. And so we coordinate our eyes with the ears at that time so that we can be able to hear. So when you're speaking slowly in a low tone, they'll be able to read your lips and be able to hear you very well. Assisting them with the hearing aids, they're taking care of the hearing aids, going for the checkups, encouraging them to be able to be social, because hearing loss actually makes people very withdrawn from the society, withdrawn from social gatherings and all that. Just like what Mama Goreti has said, I'm sure she will not go to church or to go to any social gathering. But that is really, really common for most people. And it's not just the parent. If it's an person, an adult or a young person who has hearing loss, that is one of the most common things that we expect to happen. And hearing aids or amplification is there to prevent that, because again, what Dr. Yuko said, when we are not able to use a particular part of our body, then there's atrophy, then that particular part dies. And unfortunately for the brain, when we are not able to hear sound, then we go into a mental shutdown, and we are not able to talk to people. We are disinterested with communication. Then we get something called dementia. And so for like the older adults, we start getting dementia, because then the brain is just not functioning properly, because there's no need for rest to practice. Also for people with hearing loss, it's also very good for them to get them the necessary assistive listening devices or the necessary schools if they are children, so that they can be able to learn well, they can be able to get education. So it's very important to educate and inform the society and also the person with hearing loss. All right, thank you so much, Helen. And because you've covered all that entails how to manage hearing loss, I'd like Dr. Yuko to explain to us the process of a cochlear implant, right from the beginning to the end. Daktari.
Okay, I wanted to add something on what
please
Helen.
Feel free to add, yes.
Yeah, because first of all, we'd like that when we wear specs, they are considered now fancy and maybe we look clever.
By the way, we are all in specs.
Yeah, maybe it's because we are all clever people. But I'd like a time to come where hearing aids is the same. I once saw one of a big person in Kenya doing news, and he was wearing his outside behind the ear hearing aids. I was very excited, but then I think his other hearing aids got serviced, and I saw he was back to the inside ones. I'd like to see people wear them and remove the stigma of that, because we have problems with especially children, where they don't want to wear the parents are looking for the inside ones, which are even more expensive because of the stigma. But for me, because even my father wears, shout out daddy, he wears hearing aids, and I know he insisted on getting the ones that are right inside the ear. But I'd like us to be able to wear the outside ones without having any stigma, because the outside one I prefer for me, because I find that you know that somebody has a problem. I'll know when you're crossing the road. I'll know when I call you. I'll know different, because whatever we replace, we cannot replace it to 100% like what God gives us. So that's the first thing, removing stigma. So I'd like to see maybe some big people. I would like to see a big media house like KTN employ somebody who is proudly wearing their hearing aid. That way, that's step number one. And then we also assume a lot of hearing loss is this one. Cochlear is the end of the spectrum, and there are few patients who require that. A majority of our patients, the commonest cause of hearing loss in Kenya is a preventable cause, it's infections. These ears that are just dripping, and people think it's normal. Let's say take the children to hospital. Children in Kenya have all sorts of fluids put in their ears, from mafuta ya kuku to gun oil to brake fluid to all sorts of things before they come to us. And by the time they come to us, we find the damage has really been done. And a lot of them, medical treatment, antibiotics can assist. The next step is some of them require surgery, and that can assist in restoring the ear and even creating a safe ear. Then now is when the ones who completely cannot get help, then we move on to finally the cochlear implant. So, and we are very grateful to teachers, parents, grandparents who notice and say this child does not hear. We have many children who've been told that they are mtoto ni mtukutu, they don't the child doesn't respond, the child ignores me. So instead of us assuming that all children ignoring you like that are disobedient, we can get them checked. We also have children who have been diagnosed with neurodevelopmental disorders like autism. Yes, we can have autism and hearing loss, but we also have many children who present in that way because once you don't hear, you're locked in. If your hearing is reduced, you're locked in. So then if you improve the hearing, then they also improve in their behavioral. And there are many hearing conditions that can be treated by simple medicine or even simpler surgeries or middle-level surgeries before we get to the cochlear implants.
Okay. And because of time, I'd like us to go now into the cochlear implant, and please make it short, summarize all the stages, and then we'll wrap it up with our parting shots.
So the cochlear implant, I'm sure Mama Goretti, in fact, is the one who can tell us the most.
Yeah.
But it's Helen will give us the technological details of it in a very short way. But the cochlear implant now, when you are not able to improve the hearing in any other way, it bypasses the external ear, the middle ear, and it goes straight to the inner ear and transmits the sounds to the brain, and the brain converts them. And when you get it, when you switch on when you first have the implant, you have the surgery. It's a big surgery. A mastoidectomy is not a small surgery. It is a big surgery near the brain, but it's done. The mastoidectomy, even without the cochlear implant, is a surgery that is commonly done in Kenya. Okay. So the implant is put right to the middle ear. We drill the bone behind your ear, and then we open to the middle ear, and we open the cochlea, which now goes into your brain, and the electrode is inserted there. Then we put the magnet part behind your ear, and there's the other part we put under the skin, so that it's held firmly. And then you secure the device. So now after that, you have to have like some time to heal. Some people give it 2 weeks, others give it up to 6 weeks, a month, or up to 6 weeks. Then once it heals is when you switch it on. Okay. So Helen can talk about that. But so now the child always has to protect that area from injuries, because we've had children also who've had the implants, and then soon after the surgery they had injuries and you had some damage. So you have to protect the area. So you allow them to be as active as they can, but with care. So and then in future, if you ever needed to have an MRI done for anything, disease, accident or anything, then we have to let the technicians know, so that, because with the cochlear implant now it limits your MRI chances, but with the current ones, there's something we can do to allow you to get an MRI done.
An MRI, okay. Thank you so much, Daktari. And now finally Helen, and then we'll listen to Winket with advice, and then we'll wrap it up. Helen, the stages, we are on the switch on. Before the switch on,
before we actually go for a cochlear implant, it is important to know that not every candidate who has severe to profound hearing loss is actually a candidate. And so that is why Mama Goretti said they were asked to go and do an MRI, a CT scan. So we have to do a hearing test, find that we have this kind of hearing loss, and then MRI, CT scan to make sure that the hearing organ is actually in place. There's the nerve is there, everything is working well, other than just the cochlea itself. So then we send them to Dr. Yuko. Once Dr. Yuko clears that they are good for surgery, then we do counseling to give them the expectations for this particular child, and what do they need to do once in preparation, and once the surgery is done, and what is going to happen after surgery. So it is important for parents to be able to know that it is not magic. It is not a small robot that is going to speak on behalf of this child inside the head. It's a process that now this child has been born at that particular age. If it's age 3, this child has been born at that time, and so they'll have to start first hearing sound, identifying the sound, locating sound, understanding the sound, then reproducing the sound. So that step has to go on. So during switch on now, Dr. Yuko has done the surgery 6 weeks down the line, switch on. Switch on is where now we put the external processor or the external part of the cochlea. So once we have put the external processor, we then stimulate the nerve using the electrode to be able to get some stimulation that will be able to be sent to the brain, so that the brain can be able to interpret that particular sensation or signal as sound. Then a child, the volume is increased accordingly, and a child is allowed now to start speech therapy. Speech therapy now allows for the child to be taught the meaning of a particular sound, how to reproduce that sound, to just be able to understand what is happening around the child. So my advice to parents is that just because, yes, the cochlear implant is, I'll call it the supreme, the creme de la creme, that doesn't mean that it is just going to work magic. It is a process, and it's a process where you're taught what to do, and once you're able to do exactly what the information you're given, talking to the children, taking them for speech therapy, taking them to school the way instructed, then we will be able to have a much smoother process.
Okay, thank you so much, Helen. We'll come to you for a shorter parting shot because you've taken more time to speak. So I'd like Winked to just give us your parting shot, mostly advice to parents with children who have hearing loss, or caregivers to people, adults who have hearing loss.
As she gives it, sorry to interrupt her, just to remember that hearing is we have an age of hearing. You learn how to hear from the age of 0 to 5, maybe 7. Beyond that, your brain, that area of your brain cannot learn how to hear. So and that's why even cochlear implants, if it's your first time to, you're pre-speaking, then we check your age. If you're beyond a certain age, we might not do for you, whether your CT scan, MRI, and all the other things are in keeping.
So beyond age 7, it is difficult.
It is very difficult to learn speech for the first time.
Okay, now Winked.
Okay, what I would like to say is to the caregivers, the journey is a very long one and a very hard one. Just keep on being strong and pray. It is only God who can give you the grace that you need.
It is only God who can give you the grace that you need.
Thank
you, Winked. And 2 seconds each, preventive measures, your advice to potential patients. Dr. Yuko and Helen.
I'll tell you, stop using the earbuds. They're not called earbuds. They hurt your ears. You go read them. And then all of us here, noise-induced hearing loss is becoming very common. Even your in-ears right now are very loud. I can hear them. But yeah, noise-induced hearing loss is irreversible. Okay. So just remember.
Noise-induced hearing loss is irreversible.
Yes.
That is well noted. Helen?
On the matters of noise or hearing loss, when you wake up in the morning and find that you can't hear, or you have buzzing in the ear, or your ear is blocked, kindly do not go over the counter and take medication. Please go to the ENT, have your ENT or an ear specialist look at your ear. They'll give you the right direction, because that is where now we are talking about reversible hearing loss, because then it's called sudden sensorineural hearing loss, and you can be able to recover that hearing if you are able to go to the ENT surgeon or the ENT doctor within 72 hours. Early identification is one of the best methods of reversing hearing loss or managing hearing loss. And so you going to a specialist, you identifying that child, you identifying that particular person that they have hearing loss and being managed quick enough, being fitted with a hearing aid quick enough if need be, is one of the best thing you can ever be able to do to that particular person.
Thank you, Helen. Because of time, I would have loved to continue with this conversation, but unfortunately we have to end there. Thank you so much, Winked, Dr. Yuko and Helen, for coming to the show and for sharing your story and insights from the experts. Asanteni sana. That's it from us. Remember that if you have someone with hearing loss, or you are a person with hearing loss, I believe our sign language interpreter will explain this to you. It is important to keep hope alive, and for those who are listening this now, it is important to prevent hearing loss by avoiding noise. And also, as Helen has said, it is important to seek medical advice. Do not do over-the-counter medication. Until next time, this has been the Health and Wellness Show. My name is Chebet Birir. Have a lovely evening.